Dear students, today I'm going to discuss about the topic autoimmunity. So first I will start with what is actually autoimmune diseases. So you know that the immune system is a finely tuned system which function round the clock whole life to protect the body against various foreign cells, be it microbes or abnormal cells, viruses, bacteria, other parasites, or any kind of abnormal cells. Though the immune system is up and running all the times, surrounded by self-antigens, it does not mount a response against them. At times, these mechanisms go away, and this results in injury to various tissues. Autoimmunity is a condition when the body produces autoantibodies and immunologically competent T lymphocytes against its own tissues, conditions where the mechanism of self-tolerance fail that are termed as autoimmune disorders, and the phenomenon is known as autoimmunity. So autoimmunity literally means protection against self. However, in practice, it leads to injury to self. But at clinical level, autoimmunity is apparently involved in a variety of apparently unrelated diseases, such as uh, systemic lupus erythematosus or SLE, then type 1 diabetes, then myasthenia gravis, rheumatoid arthritis, multiple sclerosis, hemolytic anemia, such and such. So autoimmune disease is a group of disorders in which tissue injury is caused by both the humoral, that means by the autoantibodies, or the cell-mediated immune response, that means by the autoreactive T cells to the self-antigen. And this autoimmune disorder may result in destruction of one or more types of body tissues, abnormal growth of an organ, changes in organ functions like that. So particularly this phenomenon have developed after the phenomenal work of the German bacteriologist and immunologist Paul Ehrlich, who describe the body's innate aversion to immunological self-destruction. In 1901, Ehrlich first postulated the existence of tolerance of self-antigens as also those situations where this mechanism would fail, leading to horror autotoxicus. More recently, an understanding of the various immunological mechanisms and disorders has led to the same conclusions, that it literally means the horror of self-toxicity. Now, if I try to define autoimmunity, so it is a system of immune responses of an organism against its own healthy cells and tissues. And it is a failure of an organism in recognizing its own constituent parts or as non-self, which allows an immune response against its own cells and tissues. So any disease that results from such an uh, aberrant immune response is termed as autoimmune disease. It is actually the failure of an organism in recognizing its own constituent parts as non-self, which allows an immune response against its own cells and tissues. So the discrimination between the self and non-self is not here. Now, what are the causes of autoimmunity? It is not entirely clear. However, some factors thought that may trigger autoimmunity, and these are genetic factors. For example, certain HLA alleles are associated with particular autoimmune diseases. Foreign antigens that mimics the self antigens, peptides antigens from certain viral or bacterial pathogens are very similar to specific self peptides. Or once an immune response is generated to pathogen, these T and B cells continue to respond to tissues expressing the similar self peptide. So this may be the causes of autoimmunity. And the immune response in autoimmune disease, that of the responses directed against infections, except that antigens, which is the self antigens, are or become the target of the adaptive immune system. So these self antigen may drive to that the process that is localized within a specific organ, such as say thyroid gland in case of Hashimoto disease, in case of Graves disease, or maybe brain in case of multiple sclerosis, or responses to them may lead to a more general inflammatory conditions, that is systemic lupus. Following initiation and trafficking, local damage can amplify disease, while the balance of these by regulation determines whether relapses or remission dominate as the disease progresses. So that is all about the autoimmune process. Now I'm coming to the proposed mechanism of induction of induction of autoimmune diseases. So a variety of mechanisms have been proposed to account for the T cell mediated generation of autoimmune disease. And it is likely that autoimmune disease doesn't develop from a single event, rather from a number of different events. Some of the proposed mechanisms are forbidden clone, altered antigen, sequestered antigen, immunological deficiency theory, genetic influence, like that. So in a forbidden clone, mutation in the lymphocytes may result in the formation of changed or altered clone. And these altered clones may recognize a host as a foreign and lead to development of autoimmunity. In case of altered antigen, some of the antigen on the host cell get altered by either chemical, biological, or physical means. Thus, they are forming a new antigenic determinants, which may be recognized as a foreign material by the host or foreign antigen by the host. In case of sequestered antigen, some of the antigen in the body are hidden from the cells of the immune system. If the organs containing such antigen are damaged, it causes exposure of sequestered antigen, thus an immune reaction to these antigens may occur. In case of immunological deficiency theory, mutations or loss of immune regulatory power, that is deficiency in immune system, results in a condition in which self-antigen behaves as foreign. In case of genetic influence, this particular mechanism has been proposed by family studies. It is well recognized that certain immune disorders predominate in females and families. This has strongly supported the role of genetic influence in autoimmunity. Genetic links have occurred between disease and HLA antigens. It's common. Now I'm coming to the types of autoimmune diseases. There are two types of autoimmune diseases. Different molecules, actually cells and tissues are affected in autoimmune diseases. The autoimmune diseases can be broadly classified as organ specific or systemic. In case of organ specific autoimmune diseases, where autoantibodies are produced targeting only the tissues of a single organ, thus affecting solely a single organ. A few examples of such disorders are Addison's disease, autoimmune hemolytic anemia, Graves' disease, like that. These diseases can be further subgrouped on the basis of tissue damage as disease mediated by the action of cell-mediated immunity and disease mediated by the action of autoantibodies. So this is organ-specific autoimmune diseases. Now I'm coming to the systemic autoimmune diseases. Here the autoantibodies are produced against a wide range of host tissues in systemic autoimmune diseases. And these diseases reflect a general defect in immune regulation that results in hyperactive T cell and B cell. So tissue damage is widespread, much more generalized in and usually lead to multi-system disorder. So tissue damage is caused by cell-mediated immune responses by autoantibodies or by accumulation of immune complexes. A few of the representative systemic diseases are systemic lupus, erythematosus or scleroderma, rheumatoid arthritis, multiple sclerosis, ankylosing spondylosis, spondylitis, etc. Now, what are the common type of autoimmune diseases? First, I will start with Hashimoto's thyroiditis. So, Hashimoto's thyroiditis is basically hypothyroidism. Means the thyroid gland doesn't function properly. So the hormone production by the thyroid gland slows to a deficiency. And the symptoms include weight gain, sensitivity to cold, fatigue, hair loss, swelling of thyroid gland like goiter, etc. So this particular disease has been characterized by type 4 hypersensitive reaction, and it is a T cell mediated autoimmune disorder. Next one is myasthenia gravis. Myasthenia gravis affects nerve impulses that helps the brain to control the muscles. It is also caused by autoantibody against muscle antigen and acetylcholine receptor antigen. And it has been characterized by the muscle weaknesses, eventually death from respiratory failure. So mostly it will function at the neuromuscular junction and affects this neuromuscular junction is affected severely. So when the communication from the nerve to the muscle is impaired, signals can't direct the muscle to contract. The most common symptom is muscle weakness that gets worse with activity and improves with rest. Often muscles that control the eye movement, eyelid opening, swallowing, and facial movement are involved in this particular type of autoimmune disorder. Next, we will come, that is multiple sclerosis. In case of multiple sclerosis, it damages the myelin sheaths that protect or acts as a protective coating which surrounds the nerve cells or the neurons in the central nervous system. So damage to the myelin sheath that has been shown here in the picture shows the transmission spread of message between the brain and spinal cord and from the rest of the body is damaged. And this damage can lead to symptoms like numbness, weakness, balance issue, then trouble in walking, like that. So this particular disease comes in several forms that progress in different rates. So here actually the disease developed by the disintegration or degeneration of the nerve in the central nervous system. Next one is type 1 diabetes. So type 1 diabetes is a pancreas that produces the hormone insulin. So beta cells of the pancreas, islets or Langerhans, that are actually producing the insulin hormone, and this insulin hormone is mixing into the blood and controlling the blood glucose level in normal blood. So without sufficient insulin, the blood glucose level raises, causing some of the common signs and symptoms of hyperglycemia. So in type 1 diabetes mellitus, the immune system attacks and destroys insulin producing cells in the pancreas. So damaged beta cells cannot produce sufficient amount of insulin and will develop, henceforth the patient will develop type 1 diabetes. Next one is systemic lupus erythematosus. So in this particular disease, SLE, so here you can see that the skin of the patient, the skin of the individual, is actually getting rashes, most commonly in the face. And the systemic forms, which is most common, actually affects many organs, including joints, kidneys, brains, and hearts. And it is due to the production of the anti-nuclear factor. The patients may suffer joint pain, fatigue, rashes. These are the common symptoms in this particular autoimmune disease. Next one is rheumatoid arthritis. So rheumatoid arthritis is a disease of the joint. Here the immune system that attacks the joint causes redness, warmth, soreness, and stiffness in the joints, mostly caused by the autoantibody of IgM type called as rheumatoid factor. And the synovial fluid of these patients contain increased number of T cells and macrophages. So There is a difference between osteoarthritis and rheumatoid arthritis, which commonly affect osteoarthritis, which commonly affect the people in the old age, but rheumatoid arthritis can start at the early age, means at 30s or maybe even earlier. And at the latter stage, deformity of the bones develop. Next one is autoimmune diseases that link to HLA type. So human leukocyte antigen system or the complex that is related to encoded by the major histocompatibility complex in human, and the cell surface proteins are responsible for the regulation of the immune system in human. So this HLA system has a relation with autoimmune disease, and they may develop the diseases like diabetes, Graves' disease, Hashimoto's thyroiditis, lupus, multiple sclerosis, rheumatoid arthritis, such and such. So this type of diseases, so far I have discussed, they may develop some symptoms. What are the symptoms? Tiredness or fatigue, achy muscle, swelling and redness, low-grade fever, trouble in concentrating, trouble in chewing, numbness and tingling in hands and feet, hair loss, skin rashes. These are the common symptoms of different types of autoimmune diseases. So the next one is the diagnosis one. So diagnosis one of autoimmune diseases. So it's not a single diagnostic procedure that is available to detect autoimmune diseases. So when you will visit to your doctor will prescribe you to go for multiple tests. We'll go to check for a combination of tests and also review your symptoms physically, you examine to diagnose, and then may prescribe for C-reactive protein assay, then anti-nuclear antibody tests, which is the first test that should be prescribed by the doctor or advised by the doctor that use when symptoms suggest an autoimmune disease. But a positive test doesn't mean that you may have one or of the diseases, but you don't confirm exactly which one you have, or if you have one for sure or not. So next one is the treatment of autoimmune diseases. Again, treatment can't cure autoimmune diseases, but they can control the overactive immune response and bring down inflammation, or at least reduce pain and inflammation. Drugs that used to treat these conditions include non-steroidal anti-inflammatory drugs such as ibuprofen and naproxen. This are functioning as an immunosuppressive drug. So they cannot cure it, they can only suppress it. They can reduce the pain, they can reduce the inflammation, but cannot heal this, cannot cure this. There are four types of immunosuppressive drugs has been used for autoimmune diseases, and these are glucocorticoids, cytostatics, antibodies, drugs acting on immunophilins, etc. Glucocorticoids that suppress allergic, inflammatory, and autoimmune disorders. Cytostatic that inhibit cell division. Antibodies prevent the acute rejection and targeted treatment of for autoimmune disorders. And then drugs are acting on immunophilins that actually catalyzes the interconversion between cis and trans isomer of the peptide bond containing proline. So that is all about autoimmune disease.